Hello everyone, I'm Dr. Jacques Conradie from the Department of Neurosurgery at Kimberley Hospital in South Africa. Cauda-equina syndrome is a neurological emergency which is encountered by few clinicians in their lifetime. Various causes can be listed, but rarely it is due to a spontaneous epidural hematoma. This case presentation is about a teenager who developed sudden acute neurological fallout without any preceding trauma. A 13-year-old boy presented with a history of abdominal pain worsening since the previous night, inability to pass urine, and lower limb weakness. There is no history of trauma and no known medical or surgical comorbidities. On abdominal examination, the abdomen was noted to be very tender with a palpable bladder. A urinary catheter drained 2 liters of clear urine, which relieved the abdominal discomfort. The patient had swirled himself and had no control of flatus, indicating loss of bowel control. Weakness over the lower limbs, more marked on the right side, especially below the knee, where there was no power reflexes or sensation, was also noted. A positive straight leg raise was present on the right side. The table shows the motor and sensory examination findings. The examination findings suggested that the spinal level was at L3 with associated bladder and bowel fallout. A provisional diagnosis of Cauda-equina syndrome comprising the lower roots L3 to S4 was made and an emergency MRI requested. The MRI showed an epidural mass compressing the Cauda-equina from L3 downwards, hyperintense on T2 and isointense on T1 with no contrast enhancement. Image 1A is a sagittal T1 MRI showing a lesion isointense to the spinal cord compressing the Cauda-equina from L3. Image 1B is a sagittal T2 MRI showing a lesion hyperintense to the spinal cord. And image 1C is an axial T2 MRI at the L4 level showing a hyperintense lesion compressing the nerve roots. A hematoma was considered the likely cause, and the child was taken for emergency decompression of the Cauda-equina. A 2-level hemilaminectomy was performed at L3 and L4 level. The presence of a hematoma was confirmed by visible drainage of blood. The spinal canal was washed out and all visible hematoma was removed to reveal the clean dura mater covering the Cauda-equina roots. Meticulous hemostasis was maintained throughout the surgery. Image 1A is an intra-operative photo demonstrating a blue discoloration at the end of the suction tip, namely the hematoma. Image 2B is a photo taken after drainage of the hematoma. The MRI was repeated the following day, which showed free space surrounding the Cauda-equina with no more root compression. After decompression, he received physical therapy and subsequent rehabilitation. On further investigation, no bleeding tendency was identified. After 2 weeks of intense rehabilitation, the child was able to walk without assistance and had regained bladder control. He, however, walked with a strange gait due to bilateral difficulty with dorsiflexing his feet, requiring him to compensate by lifting his knees excessively. On his 6-month follow-up, he had close to normal gaits with improved dorsiflexion and near normal motor score. Spinal epidural hematomas can originate from the dorsal or ventral epidural venous plexus, especially after trauma, or from weakness in the internal venous plexus, which can tear during straining, coughing, or gagging. It can be acute, subacute, or chronic, and presents with spinal cord compression. The severity of neurological fallout depends on the level and the size of the hematoma. Surgical decompression is a treatment of choice with either laminectomy or laminoplasty. Conservative measures can be considered, but only in select cases with great caution. The best chance for full recovery is if the spinal cord compression is relieved within 12 hours, which shows a 52 to 69% chance for recovery, compared to after 12 hours, which only shows a 25 to 29% recovery. The take-home message from this case presentation is that Cauda-equina syndrome is a neurological emergency that requires urgent recognition, and in the case of an epidural hematoma, it requires urgent drainage to improve the chance of full recovery.